Well, tomorrow is surgery day, the day I'm having a total hip replacement on my left side with ceramic on ceramic joints. So if you don't know who I am, I'm Steven. I'm an ultra runner. It's what I love to do, is run, be in the mountains, trail running races that are long distances, 100-mile races. And so started having pain back in December after 4 different surgeons, 3 MRIs, an ultrasound, lots of x-rays. Found out that I have a torn labrum in my left side. It's completely calcified, and I also have hip dysplasia as well, which meant that if I went through with a normal labral repair or reconstruction, it likely would fail in a couple years, and I didn't want to do that. So then the option was either a periacetibular osteotomy, which is where they cut the pelvis, move it, put screws in. All my research, the recovery from that looked horrible, and I did not want to go through that. And so met with a surgeon who's one of the best, certainly in this area, but from what I've read, also probably in the country for hip replacements. So decided to go that route. My surgeon swears that I'll be able to run again, so follow me along in this journey where we'll find out if that's true, because I'm going to do the surgery. Unfortunately, I did just find out that my right side is also messed up, and I just had an MRI 3 days ago on the right side. I'll find the results out of that in a couple weeks when I go back in for my 2-week follow-up on the left and see what kind of surgery I need on the right. But eventually, next year sometime, hopefully I will be running again. I'm going to document what it's like to be a runner and recovering from this type of surgery. I've already got physical therapy scheduled, all of that. So right now today, I'm actually just going through and kind of getting things ready for the surgery tomorrow, what we're gonna need in the house to get everything ready. So with the surgery being tomorrow, a couple things, 3 days out from the surgery. So starting Friday, I was not to use any normal soaps, any lotions, nothing. They actually gave me this special Hybacleanse, I don't know, this soap right here that I'm supposed to use to wash my body. I can use regular shampoo on my head and my face, but not anything else. So I got to use this stuff, and this isn't great. It doesn't work very well, and it dries the body out. So they also gave me this, which is a Medline Remedy Clinical Moisture Skin Cream. It's basically just a moisturizer that is paraben-free, hypoallergenic, pediatrician tested, unscented, all the stuff that I can use if I want. I haven't used it. And then tomorrow morning, they also gave me this. It's an Ensure pre-surgery clear carbohydrate drink. They said I'm supposed to drink this 4 hours before my surgery. It's the only thing I can drink. I have to stop drinking water 4 hours before the surgery, so I have to drink this. And it's just supposed to help me through the surgery. It's essentially a better Gatorade is how they tried to explain it to me. But about a week before the surgery, so starting on Sunday of last week, or Monday, basically, September 2nd. I started September 2nd. I was not allowed to take any supplements, so I had to stop taking my multivitamins, my vitamin C, creatine. I do lift weights, so I had to stop taking creatine as well. Couldn't take any ibuprofens, only could take Tylenol. That's the only thing that I was allowed to take, really. Just getting my body ready for anesthesia. Had to go in. I had a lot of labs done. They were very thorough, which was awesome. Just incredibly thorough. So many labs and blood tests were run to check everything to make sure I was 100% ready for the surgery. It really helps with Dr. Swan just feeling confident that the patient's going to have the best possible outcome, which I am very happy about. So then one thing we learned after my wife's surgery, because if you don't know me as well, my wife had a labral repair a little over 2 years ago now, and it was March of 2022, I believe, is when she had that surgery. It's going very well for her now. She's actually about a little more than a month out from her first 100-mile race, or her redemption. She tried it, didn't. She DNF'd at mile 54 because she had a torn labrum. So we found out afterwards. So she's got that race coming up soon. So she's doing well, which is very encouraging for me. But we learned in her surgery process that this little device right here was incredibly important. This is a raised toilet seat with removable arms. It's 5 inches higher. So basically, it will allow me to sit on the toilet and not have my hips be at such an angle. This is just from Amazon. I'll pop some links in the description below. So the toilet seat, literally you just push the pins in place for the arms, and then it just sits over top of the toilet, and then this mechanism tightens this around the toilet bowl to keep it in place. And yeah, so it should be pretty simple, which we highly recommend checking them out, because for my wife, it was amazing. She definitely needed that. And then also back, well, they were there somewhere, we have crutches we bought as well, because I am very tall. I could not use her crutches, so we have some very tall crutches for somebody over 6'1". I'm 6'3", so we got that ready as well. Found the crutches. Here's the crutches. We got them adjusted, got them ready for my height. All good to go. I'm gonna get those ready because we have to take them with us to the hospital tomorrow. But then also I bought on Amazon basically it's a bunch of pillows that I can lay in the bed and be more comfortable, because I might be in the bed for a little bit. Gonna be able to put something under my knees, behind my back, neck. So it's a whole bunch of pillows in this thing here that form this cube, but they unfold and you can lay them under your body. I'll show you some video later once I'm actually in the bed using them, but hopefully, because I might be working from my bed for a little bit, that'll be a little bit more comfortable. That's the plan. The other thing that we really learned from my wife's surgery, and that the doctors recommended, which luckily we already had, is the Bragg Polar Care ice machine. And so that's this guy right here. This essentially, you just open it up, put water and ice inside, and then you secure the top. Kind of hard to do one-handed. Secure the top, close it, and then this hose connects to that right there, which goes around my hips, like around my waist, around the hip, and it flows nice cold ice water through it, and it also has compression to like kind of squeeze as well, massage my hip. And so that will really help with my just inflammation, I guess. And my wife said it was awesome and a definite must. So if you're having any kind of like hip surgery, definitely get this thing. It's not cheap, but it's worth it. I'll try to find a link and pop that below as well. Well, that's about everything that I have to get ready for the surgery and the day after recovering. I'm doing pretty well. Woke up a little anxious this morning, a little nervous, just kind of odd, thinking that literally tomorrow morning they're going to be cutting off my femoral head and putting a spike down inside my femur and giving me metal in my body, which is just going to be very, very weird, to be honest. So we'll see how it feels once I get used to it, hopefully, and walk, and I don't know. We'll see. One other thing is I do also have all of my prescriptions already. My surgeon called in, I think it was 7 different prescriptions for post-recovery. Lots of different things. I mean, obviously this is going to be dependent on your surgeon, whatever you might be going through, but they gave me meloxicam, which is basically, a pain type thing. They gave me baby aspirins to take to prevent blood clots, and then I can take Tylenol later if I need it. They also gave me Keflex or cephalexin, which is an antibiotic, and Tramadol, which is a pain medication. It's a less addictive opioid. If that does not work for pain, they did prescribe oxycodone as well that I could take, and they also prescribed a muscle relaxant and Zofran, which is for nausea. So they gave me a whole schedule, time of day to take all this stuff. We'll see. A lot of people have been very positive, saying that their pain was quite low, to be honest, a lot less than they expected. So I'm hopeful. We'll see. But I have what I need, should I need it, which is always a plus. Well, my surgery tomorrow is September 9th. It's at 7:30 in the morning with a check-in time of 5:30. It is in Denver, so we're gonna have to leave about 4:20 in the morning to get up there, park, get in, checked in. Not sure why check-in is 2 hours before, but anyway, hopefully I'm one of the first surgeries in the morning. We'll see. I don't want the doctor to get too far behind schedule, so we're waiting forever, but we'll see how everything goes. Well, for the rest of the day, I've got a podcast to record here in about a half an hour with a very big athlete. Excited about that. And then just going to try to enjoy the day. Spend some time with family, go to the pool, hopefully, relax, and enjoy walking with my own leg, even though it kind of hurts. One other thing that we really learned from my wife's surgery that has made things a lot easier for that ice machine. So the ice machine takes ice, obviously, and if you're using it from your refrigerator, it goes through quite a lot, and a little more than the ice machine can actually produce. What I chose to go with, though, were these right here. This is a silicone muffin pan, basically, and we fill up with water, like I have some in here right now that are freezing, and then the finished product right here, so it makes a little kind of a puck of ice. So that way I'll probably put, I don't know, 4 or 5 of those in each time I need it, and have good ice ready to go, and won't take up as much of, from our refrigerator here, which might struggle to produce enough ice. So yeah, give it a shot. I'll try to put a link down below as well. Whew. That is very sweet.
And then for an emergency contact, I have Valen.
Valen.
Okay, so this ties on the side and then on the back, and then you can go ahead and put your belongings in this belonging bag. I'll put a label on this with you, so it'll go with you to the recovery room.
Okay.
You can put the socks on to match. But before you do that, I'll have you do a full body wipe down with our CHG wipes.
My sexy sock.
Mm-hmm.
Oh yeah, I'm styling. You can have the matching socks.
Yellow's your color.
Oh yeah, it does go well with my complexion. Just out of surgery, waking up, and feeling okay. Drinking some coffee right now, and starting to feel a little bit of aching in the hip, but I guess I'm doing pretty well.
Oh, you are feeling cold now?
Was a little bit. That's why I got the coffee, because it was, just feeling a little bit of aching in the hip right now. But overall, not bad. She said it was coming up well, out of the stuff. So
yeah,
really weird though. Like when they took me back to the operating room, like I was fully conscious, and they're like doing stuff to me, getting me ready, moving me to the other table, like fully conscious, which was just kind of awkward.
yeah.
I was nervous. Yeah, definitely.
What you eating?
Rice, white rice. Val went and picked up some food. It's good.
How's sensation in your feet?
Oh, fine.
Okay.
Yeah.
Cool.
Total feeling just seems to be back.
Alright. Dizzy, lightheaded, first of all?
No.
Okay. So the thing with crutches is we don't want you to treat it like it's a broken ankle. We still want you to walk, and the crutches are really just here for balance.
Stability. Okay.
Yep. So we're gonna head this way. Surgeons want you to use crutches or something as much as you're kind of able to tolerate. The biggest thing for that is just so the prosthetic totally solidifies in your femur and in your acetabulum. So especially if you're going to be pounding it a lot, we want to make sure that it has as much time as it needs to.
And so you said one crutch, so use the opposite crutch.
Yep. So handrail, crutch, and then right leg. Perfect. Easy peasy.
Yeah.
Good. It's not bad at all, actually. So you're going down, crutch is going to go down first. So there's your support, and then left leg. So that first. So really specifically for everything.
It's just that motion of getting it down is a little uncomfortable.
Yep. So that hip flexion motion, or like the advancement, is going to be the most uncomfortable thing that you'll do just because of where the incision is.
Okay.
Oh, I could get that for you. Use your words.
I'm just gonna use that fancy little thing there. Well, just made it home from the hospital. Took another oxy pill because I was a little bit past due, but we didn't have them with us, and so hopefully keep feeling okay. Pain-wise, got on the couch, propped up, maybe, hopefully, take a nap. I do have these super sexy knee-high stockings, though, so, oh yeah. What was really weird at the hospital, though, was so they gave me like a spinal tap, or an epidural, essentially, and a concoction that they put through the IV to get me feeling good and relaxed, and I was feeling good. And they took me back, but I was not unconscious when they took me into the operating room. I was awake, and that made me feel a little bit nervous. I started getting nervous shakes, and it was just weird because, I could see everything laying out on the tables that they were going to use, and then they put these ski boot machine things, is what she called them, on each foot. and that was because they were going to put me on this special table to my left that had like this weird looking contraption. I wish I could have got a camera in there, but it was essentially they were going to like lay my back on this part of the table, and then my legs were going to be, it looked like rods, like attached to these 2 rods through the ski boots they put on my feet, and then they slid me over to the other table. They put like this hard thing under my back and then slid me over, and it was just weird being awake for all of that, which made me a little nervous, but it was fine. You know, obviously I made it out okay, no issues. Just a little disconcerting, I guess, but overall, I don't remember going to sleep either in the operating room. I don't remember them saying any kind of like, you know, countdown from 10, nothing. I just remember being in the operating room, seeing that, and then waking up in the recovery area. So yeah, so now I'm just gonna recover here at the house for a little bit, drink some more water because I'm very thirsty, and just relax for a bit. Well, good morning from the bed of, I guess this is day 1 of recovery because yesterday was surgery day. It was not a good night last night. Very, very rough, but learned something that'll hopefully make the other nights better. So, you know, I'm taking my medication like I'm supposed to. Got in bed, and I was just laying in bed like I normally do. So I was laying on a memory foam pillow just like this one right here, and so my body was pretty much flat in the bed, which worked okay until I woke up at about, I think it was about 11:30 at night, and I was just in excruciating pain, the most pain I've ever had in my life. It was the type where I'm like breathing erratically. I couldn't speak. I was like, if you know how they give you pain scales in the doctor, like 1 and 10 is like, you know, to brings you your knees and tears. Well, I was an 11 because I was in tears, incredibly painful. And so my wife got up. I woke her up because I woke her up just with the way I was behaving. It was so painful. So she got up, tried to get the ice machine hooked up to my leg and going, and doing so I was like propping myself up in the bed so she could slide it under me, and I found a little bit of relief from that. And so we ended up getting these pillows out, which were the memory foam kind of pillow cube I told you about the other day, but it's a couple of them stacked up, and I've got more down there. But basically, these are allowing me to be propped up a little bit. And I think the issue was laying flat in the bed was putting too much stress on my hip flexor on the left leg. So I was laying like flat instead of like, you know, propped up a little bit. And so it was just creating tension there. And they did say at the hospital that that's going to be the most painful place for a while because that's where the incision is right there at the hip flexor. So once I got propped up in this, got the ice machine going, I started feeling a lot better, and I was able to, you know, sleep a little bit, but I did have to get up. Several times I had to wake up at 1 o'clock to take more medication. I had to wake up at 4 o'clock to take more medication. And then I just woke up at 7 to take more medication. And throughout the night as well, I would also turn the ice machine on for about 25 minutes to get a little relief, you know, from the swelling and the pain a bit, but it was rough, very, very rough. So this is the ice machine here. It's wrapped around my hip, and then I've got a pillow underneath of the knees as well for a little more comfort. And it's just down there on right now, but I'll take this off here in a minute and show you the bandage where the incision was. It's a pretty good sized bandage. All right, so this is the incision. Just got the ice machine off. You can see this. I don't know. This bandage is probably, I don't know, 8 or 9 inches long. And underneath of there is the incision where they did everything. You can see the markings here where they had marked the hip a little bit to make sure they operated on the correct hip. So I gotta leave that bandage on for a week and then can take it off and see what it looks like. Well, I made it back downstairs and assumed the position on the couch right now. A little painful coming down the stairs. What's really odd is my left ankle hurts a lot, like a whole lot. And I'm wondering if it's because when they put my feet in those like big ski boot things and hooked it to the special table where they had to like move my leg way up in the air when they were like flexing things, if they like tweaked the ankle or something, I'm not sure, but it's quite painful to flex it. So I've got in-home physical therapy today. They're coming at 1 p.m. So I'm gonna talk to them about it too, but we'll see what all they do at 1. So for now, Just gonna be a lot more laying on the couch, watching Netflix, YouTube. I'll probably get my computer, do some stuff maybe, but yeah, a lot of sitting around. Well, I made it upstairs in bed now, propped up on my pillows, but the pain blocker they gave me at the hospital is definitely wearing off. They said it could be, 24 hours, maybe close to 48. And it's definitely wearing off because I'm having more pain, but I'm also like shivering, very cold, and that's one of the side effects. So I've got the ice machine on as well because my hip is hurting and I'm cold. So not a good combination. I've got blankets on, I still have clothes on in bed, and that's very rare. I usually sleep naked, so I got the fan off as well. So I've just been so tired today and exhausted, feeling like I was sleeping, but I could hear everything. So hopefully tonight is better than last night, and hopefully tomorrow is better than today. Well, good morning from day 2 of recovery. Last night was much better than the night before. I did not wake up in excruciating pain at all, which was very nice. I went to bed very early though because I was exhausted, and I was very cold. I was like shivering, so that was weird. But woke up warm throughout the night because I had to take medicine again at 1 o'clock and 4 o'clock. So I woke up and I was warm then, so that felt better. But yeah, slept okay considering I had to get up. Just finished having some breakfast and sitting here on the couch now. I still have not, TMI maybe, but I still have not pooped at all since 5:30 in the morning on Monday, and it's now Wednesday. That's one of the symptoms of the opiates, is I can do that, so I need to have my wife get some stool softener and hopefully make things go easier. Hopefully that's not too much information for you, but hey, trying to be real. Definitely recommend you get yourself a hot nurse, because she did this for me here. I've got my 1 o'clock, 3 o'clock, 7, 9, and 10 p.m. pills to take, and then she'll fix it up for the night as well, because I do wake up at, well, I have pills I take at, well, it's right there at 10, but then also 1 a.m. and 4 a.m. and 7 a.m. Here comes my hot nurse now. Alright, have a good run. She's going out for a run now, because, yeah, she can still do that. Well, hello from day 3 of recovery. It is Thursday morning. Yesterday I did take a shower, actually, last night. Felt really nice to get clean and feel human again. I was able to pretty much wash most of myself. I did have to have my wife wash, like, my lower legs, because I just couldn't bend over to do that. But definitely felt fine. Good. Slept well again last night in that kind of reclined position with the legs propped up on the pillows. I've been taking some stool softener, so I'm gonna keep it real with you guys. Nothing yet. Hopefully today's the day. We will see. But my wife just left to go do some work, so I'm here at the house by myself, able to get around okay for the most part with the crutches and pretty much do what I need. So yeah, just binge watching some Black Sails right now. Well, in the bed for the end of day 3 of my recovery, and went pretty well. Had the in-home PT today. We did some movements where he would assist me lifting my leg up, lifting it down and bending it down to the side. We walked outside in my cul-de-sac for a little bit, which was nice to get outside. I walked again later when he was gone as well, just wanted to get outside, which is really nice. But the biggest exciting news is that finally, after 88 and a half hours, I pooped. Stool softeners were a must, but yeah, it was 88 and a half hours. It's crazy. So anyway, I won't go into more detail. But if you have the surgery, definitely recommend getting stool softeners from the get-go. Start taking them. Don't wait a day or two to start taking them. Another thing I'd recommend, I showed you at the beginning of all this, the toilet seat. It's the same one that we had for my wife. We bought another one, but it's the same type, basically, which works great for women, but it is not good for men and our anatomy, if you get my drift. So that was very, it just doesn't work for men. So there's one out there. I'll try to put a link in the description for that one as well. There's a couple of them. where it's like has some legs that go to the ground, and then there's like an actual toilet seat with like an opening at the end. It looks much better for men. So get one of those, not this one that I have right now. All right, we're gonna go to sleep. Hopefully get a good night's sleep. I've got PT again in the morning at 9, and yeah, we'll see how things go. Well, it's day 4 of recovery. It's Friday now. Not feeling good today. Just woke up this morning in like sweats. I was very wet from sweating. Just did not feel good. My head felt completely out of it. I didn't eat anything, and normally I've been eating like a Belvita blueberry cracker thing in the morning before I take my medicine, but I was having such dry mouth I just decided to just take the medicine, which was a bad mistake because I felt horrible all morning, all day. I had PT today, but I couldn't do anything except lay on the couch, which luckily he was still able to do a lot of manual releases, and which was really good. But I've just been stuck on this couch. I've not really eaten much all day. I've got a smoothie right there that Valen made for me. Just not feeling like I want to eat. So earlier today at I think it was 9 a.m. I took half of an oxy pill instead of the whole one. And then at 1 p.m. I did take a whole tramadol. And then 3 p.m. I was supposed to take an oxy. I was going to take a half, but I decided to skip it completely. So we'll see if that's a bad idea. I did have a fever, aches and chills. My incision area is a little bit warm, so we were a little concerned. So I did reach out to my doctor, sent them some pictures of the leg. They said that was perfectly normal to the way it looked, and that the fever is totally normal. That happens in like 40 to 50% of hip replacements. People get a fever just because, they did a major surgery. So told me to keep an eye on it, make sure that the fever doesn't get worse, or I don't start seeing any severe redness or anything in the leg. And if that's the case, then I can go to the hospital and get that checked out. But yeah, not feeling good today, which sucks. I was really hoping to be feeling a bit better. So we'll see. Well, day 5, I guess. Tuesday, Wednesday, Thursday, Friday, Saturday. Yeah, 5 days of recovery. And today is definitely better than yesterday. Yesterday was very rough. I really think it was centered around the tramadol medicine. So I had previously stopped taking the oxy and was taking tramadol, which is another opioid, but that one has always made me feel worse. Just out of it. It makes me sweat a ton. Like I'll get just incredibly hot, and like that's why my hair looks like it's fixed, because I was sweating so bad this morning laying in bed. I just kept like wiping my forehead, and it was ridiculous. So decided to stop taking the tramadol and start taking the oxy again. So I'm taking half a pill of that on the same schedule that I was taking oxy on originally, which is like every 6 hours basically. But yeah, I just went for a walk. Felt good to get outside, a little hot, but felt good to walk around. Hopefully I'll go for another walk later, try to do some PT exercises. But now just got the ice machine on, and yeah, just gonna relax for a bit more after going for a walk, because my legs fatigue very quickly right now. Well, it's the end of day 6, and it was a okay day, but also a rough day. The ice machine that I had broke and just wouldn't turn on. So spent 7-8 hours without any ice, and it was miserable. Got very swollen feeling and just horrible. So anyway, we did find another ice machine on Facebook Marketplace, and those people were amazing. It was late at night. It was like 9:30, and we messaged them, hey, when can we get this? And apparently the husband had just had a hip surgery for him, and so he knew the pain I was going through. So he's like, yeah, you can get it tonight. We'll meet you. And so they drove and met us, which was amazing. So kudos to you all out there if you're watching. Thank you so much. But when I was getting in the shower tonight, I noticed I had crazy bruising on the back of my leg, like all up and down, like a lot of bruising, more than I've ever had. So hopefully that's normal-ish, I guess, for a hip surgery, hip replacement. I don't know, but I'm having a lot of just stomach discomfort, a lot of like pains. I don't know if it's got to be one of the medicines, but I'm just having stomach pains and diarrhea the last 2 or 3 days, and it's still not going away, which is not good when you just can't get up and move quickly. So a little frustrated at all of this, but oh well. So anyway, day 7 tomorrow, back to work. All right, day 7, 1 week post-op. I'm back to work today. I was in my office for probably about 3 hours this morning, sitting in my chair. I had the chair as high as it would go, and I was kind of leaned back a little bit. It wasn't too bad. It was okay, but I needed some ice, so I'm back in the bedroom right now. I've got the ice machine going, and then obviously I've got this pillow situation right here, propped up, and then I've got the computer on my lap on another pillow, and just trying to do as much as I can. It's obviously not as efficient with one laptop screen versus my 3 monitors in the office, but I'll do what I can and get as much done. Yeah, so 1 week post-op, doing okay. I'll finish up my antibiotics today. They'll be done. Hopefully that's the medicine that's causing my stomach discomfort, and maybe it'll be done when I finish those pills. Would be awesome. I would love that. But yeah, everything else, the pain feels okay. So I gotta try to get some work done. Well, that's it for week 1. Stay tuned. I'm definitely going to be documenting this whole process all through my recovery, going all the way back to when I can actually run and train like normal. So stay tuned. If you are a ultra runner, trail runner, athlete, trying to get back to sport, impactful sport, meaning high impact on the joint, then stay tuned because I'm going to have lots of content coming for sure. Subscribe if you haven't already. That way you can see this stuff on your channel wall probably. But yeah, thanks for watching. I appreciate you. Stay tuned for the next episode. I'm not sure when it will be out, but sometime in the near future.